Good morning. It is 9:22 a.m. and the council's meeting for the purpose of a work session this morning. As mentioned earlier, the Law and Justice Bed Capacity and Renovations Project work session will be rescheduled to another date. With that said, I will hand it over to the Commission on Aging to provide the 2023 annual report. Thank you so much.
Thank you, Councilor Belcott, and thank you to the County Council for giving us this opportunity to provide you with an update. But before we begin, I just wanted to introduce a few of the members of the Commission that are here today. We have past Chair and current Vice Chair, Cass Friedland. We also have Larry Smith and Donna Mason attending. And we're also fortunate to have our staff support, which has been very critical to our operations and our success, Susan Ellinger and Amy Wooten, who have been our staff support, generously provided by the planning staff head, Dr. Oliver Orjanko. So for that, we're very appreciative. Good morning again to you all, and we're very excited to be able to have this opportunity to present our information to you. We're at a point now where we have, I think, the highest level of engagement and enthusiasm on the Commission that I've seen in my 5 years of experience. So we have an opportunity here to really seize on the momentum. Next slide, please. This is a brief agenda. We're going to give you a little bit of background on the Commission and how it was formed. We're going to talk about our 2023 work plan and what we accomplished there, and then look at our plans going forward for the remainder of 2024. And then we're going to leave plenty of time for discussion and any questions that you may have. Clark County, as everywhere in the country, is anticipating a surge in the number of residents 60 or better, and by 2035, it is anticipated that there will be 1 in 4 county residents. So a quarter of the county is going to be projected to be 60 or older. With the knowledge of this change coming in 2012, the then Board of County Commissioners approved the original Aging Readiness Plan, and as a result, formed the Commission on Aging, which we're here now. The point was to include in this Aging Readiness Plan strategies that would improve the community for both older adults and the community as a whole. Next slide, please. In 2022, we encountered the 10-year anniversary, and the Commission on Aging recommended that the plan be updated. And there's a number of reasons behind the genesis of this update. First, there was a larger generation of people reaching retirement age now and leading to a very diverse population in age, race, and income of older adults. There was also a need to address major changes since 2012, such as new transportation options, increased housing costs, new housing choices, as well as addressing changes in the technology. And fortunately, as we experienced the pandemic, we had exceptional staff support to be able to go to a virtual meeting strategy and to continue our work. So for that, we're very fortunate. And then, of course, there was the pandemic and lessons learned from that, which was the genesis for a new chapter on emergency preparedness. The County Council also approved a budget for a consultant to help us update this Aging Readiness Plan, and for that we want to thank you again for allocating those funds. It was critical in helping us move forward. Now let me pass the presentation on to our Vice Chair, Cass Friedland.
Thank you so much, Franklin. Thank you again, everyone, for allowing us to present this information that we're really excited about. Public engagement was the focus of the Aging Readiness Plan throughout the project. Early engagement included a survey of older adults and focus group meetings with service providers and other relevant agencies. These meetings focused on what makes Clark County an age-friendly place and what opportunities and hurdles there were for making improvements. Next, the council hosted 3 public workshops, with the first 2 centering on evaluating the existing strategies and brainstorming ideas for new strategies to improve the community. The final engagement event was a prioritization workshop. Each community member was given 5 dots per chapter and asked to place the dots on the strategies most important to them. Input on the strategies and priorities were also gathered online. Next slide, please. Upon completion of the public engagement events, the consultant created several drafts of the new proposed plan and submitted them to the Council Commission on Aging for review. The updates addressed changes in the last 10 years, revised the data and maps in the document, and included new technology and services. It also reorganized the plan, which now covers the following topics. The Healthy Communities chapter, which describes the current opportunities in Clark County for older adults to access healthy food, parks and recreations, and goods and services. The housing section provides strategies that address the various needs of older adults in Clark County, including those that are geared toward the needs of older adults, like accessory dwelling units and shared housing. The mobility chapter includes strategies based on the transportation and mobility needs of older adults, and it outlines ways that older adults tend to travel and areas that could use improvement, such as public transit, walkability, ADA accessibility, and others. The civic involvement includes strategies based on increasing older adults' civic involvement in the county, which is huge. And finally, the emergency preparedness chapter, which is a new addition to the plan. This chapter provides strategies that outline how older adults could be affected by natural and human-caused hazards, and other ways the county can improve the health and safety of older adults. We're now going to give you some examples of the goals and strategies from these chapters. Next slide, please. Good, we're aligned. Goals in the Healthy Communities chapter address improving access to healthy food, creating safe and accessible parks, green spaces, and community gathering spaces, creating a welcoming and age-friendly built environment, developing local and community-based healthcare resources, and providing resources for caregivers. Examples of the strategy of this chapter include adding universal design standards into all park plans. Universal design is a design process that aims to create environments that can be used by all people, regardless of their age or ability, and providing educational opportunities to caregivers and older adults about virtual communication with doctors, such as telehealth and instant messages. Next, please. The next chapter is on housing, and the goals include providing a range of housing for multi-generational communities, providing housing that enables people to age in place, which generally means staying in their own home or community if their abilities change, and supporting the development of more affordable housing. An example of a strategy from this chapter includes removing barriers to the development of smaller dwellings, including accessory dwelling units or ADUs. ADUs are an adaptable and generally affordable housing opportunity that present an especially great opportunity for aging in place because they can be used by caregivers and family members who provide support for older adults or by older adults themselves. Next slide, please. And next we have the mobility chapter, and the goals in this chapter include designing transit options for people who are older and have a disability, increasing alternative transportation options in areas not well served by transit lines, design a community for safe walking and rolling for a range of users and ability. Rolling refers to any mode of personal transportation that involves wheels, such as bikes, as well as wheelchairs. Promoting land use and design standards that encourage walking, rolling, and transit use. And an example of a strategy in this chapter includes expanding the network of complete streets. AARP defines complete streets as streets that are designed and operated for safe, comfortable, and convenient travel by pedestrians, bicyclists, motorists, and transit riders of all ages and abilities. Next slide, please. And the next is the civic involvement chapter, and the goals in this chapter include supporting the efforts of neighborhood associations and other volunteer groups to reach and engage older adults. This can involve things like connecting with AARP resources and networks to expand the capacity of local governments, supporting cross-cultural and intergenerational community events, and continuing to offer a variety of engagement opportunities in person and online. And examples of strategies from this chapter includes teaming with the Area Agency on Aging and Disabilities of Southwest Washington, or ADSWA, and neighborhood associations and other partner agencies to share and distribute best practices for reaching older adults, and connecting youth and school organizations with older adults. Next, please. And the final chapter is a new addition that we're thrilled about and addresses emergency preparedness. And the goals in this chapter include mitigating the impacts of potential hazards before they occur, preparing for natural hazards through education and improved communication, with the goal of increasing resiliency as emergencies arise, and providing essential services during hazard events. Strategies include working with the Clark Regional Emergency Services Agency, or CRESA, on hazard mitigation and emergency preparedness planning to ensure older adults are well integrated into that planning, and encouraging neighborhood associations and homeowner associations to work with CRESA to educate community members about emergency preparedness and implementing local programs. Thank you so much. I will now pass the presentation back to my friend Franklin Johnson.
Thank you, Cass. The Commission on Aging would like to take this opportunity to express our appreciation to the County Council for approving the Aging Readiness Plan update that we had earlier in the fiscal year back in September. Following the approval that we received from you, the Commission began implementation efforts and chose community engagement as their topic to focus on for the remainder of last year. 18 of the 67 strategies outlined in the annual Aging Readiness Plan were identified as priority strategies that were identified through an exercise at a community workshop. Priority strategies are planned for early implementation because their importance was highlighted by the community, and they lay the groundwork for supporting strategies. 2 priority strategies were chosen from the Healthy Communities chapter. The strategy chosen reads, educate older adults and caregivers on information and resources provided by ADSWA, or the Area Agency for Aging and Disabilities in Southwest Washington. This strategy received the highest number of votes overall in the priority strategy workshop. And from the Civic Involvement chapter, the chosen strategy states, team with ADSWA, neighborhood associations, and other partner agencies, such as the Public Health Commission, to share and distribute best practices for reaching older adults. Next slide, please. These implementation efforts were included through 3 interactive fireside chats, and we specifically chose this particular method to create a conversation, not just give information, but to exchange information and ideas. how ADSWA and the Commission on Aging can work together on community engagement, experiences with effective community engagement from local area experts on aging, and the creative initiatives of Age-Friendly Greater Pittsburgh, an older adult-focused organization in Pennsylvania. So through these fireside chats, we were able to glean some really insightful benefits on how we might consider moving forward as we look at our implementation of our Aging Readiness Plan. The Commission also helped distribute resources about ADSWA to libraries and other public institutions as a way to help connect community members with the resources that they need. Next slide, please. In addition to our 2023 fireside chats, the Commission also wrote letters of support to the Ridgefield ADA Mobility and Access Plan and the Philida Senior Park Housing Project and PACE Project. Supported proclamations for Older Americans Month and National Caregivers Month, created a summary document outlining the work of COA does and distributed at community events and presentations. And we also gave presentations at 13 local community meetings, including local city councils, meetings, and neighborhood groups. And then we also presented a Silver Citizen Award, which we do annually, that recognizes an older adult who is having a tremendous impact in the county. This year's recipient was Pat Suggs, a Washougal resident whose lifetime service spans 47 years and includes volunteerism in many community programs such as the Drug Take Back Program, Children's Home Society of Washington, and Two Rivers Heritage Museum. And I just want to take a moment to say that we have a tremendous amount of work being conducted and produced by volunteers here in our county. And I think one of the things that I personally have enjoyed about being in this area is opportunities that are provided to citizens to engage and support community activities. So for that, we're very appreciative. Next slide, please. This year, we're going to be focusing on emergency preparedness, and as Cass mentioned, we're having a series of fireside chats with various members of CRESA to look at how to prepare emergency go kits and how to step by step give our older adults reasonable strategies for producing and producing these kits and preparing for emergencies. We recognize that there is a variety of income situations and so forth through this community, and so we wanted to have a plan that was flexible enough to affect all of those particular entities. For that, we want to thank you for the time and ask if there's any questions or further discussions that you'd like to have.
Thank you, Franklin. I spoke to Cass at the Philida Park ribbon cutting about this work that you all do, which is so important. I was a caretaker and executor for my mother who passed away, and at that time, there was nothing like this that existed. And when you're dealing with all those things and you're trying to figure out what to do, what's COBRA, any other transport, like you mentioned, transportation. There's all these moving pieces and parts. I wish I'd had a roadmap like this back then. And just recently, both my older in-laws both passed away, and we had similar issues. And they actually had lived in Pittsburgh, but they were in Florida and actually had very good resources and support. So I was grateful for that. But this is why this work is very important and is so important for our community. It's awesome. I was wondering, where did you put the surveys? Where did they go out? Like, how did you get those out to the different community members?
We put together the surveys and we distribute them through AMR to their clients. We went to different community organizations, neighborhood associations, and we also had some articles in some of the news outlets to let people know that this activity was going on, and we received feedback online through that. We also had these surveys printed up in different languages to meet the different ethnic populations that we have in the county.
We also had CTRAN and the Vancouver Housing Authority as well. That was really a tremendous resource. And we also had reached out, I think, to fire departments and things too, to see if that was a possibility to add them. Yeah. So we had ultimately about 425 responses to that. So we felt good.
I was going to ask about CTRAN. I wondered if you partnered with them. All right, thank you. Other counselors, comments?
Chair.
I just want to, she can go ahead.
Counselor Barman, go for it.
Oh, I started to say, go ahead, Sue. So what I was going to say was, again, a compliment to you all. Having attended the presentation on the emergency kit preparedness, consistent with your emphasis for this year, I just thought it was really, really well done. You know, sometimes you hear emergency kit commentary that is so basic that it's at, I'm going to say, too low of a level to really be helpful. It was not the case with this presentation. It was very well done and very informative, and thank you for doing that.
Thank you so much. We're so excited really about our work with CRESA. The way that the content is presented to us, because we all realize that we're super not prepared as a commission. But really, I think for me, what really has made a huge difference is thinking about resiliency, and I mentioned that earlier, and that's what CRESA says over and over again. In other words, it is really difficult to make change as you get older, and it's difficult to think about not being necessarily in your home for any particular period of time. And so just at least pre-planning, but also talking about it a great deal with folks to say, well, this may happen and this may happen, what are we going to do? And just throw some scenarios out there. And I think that does increase the ability, hopefully decreases stress a little bit, though it's going to be stressful regardless, but thinking about being elastic people, as elastic as we can be.
And also, the way that the information was presented, I thought was really, particularly because they stress things that work for you as an individual rather than some, theoretical go kit. So they talked about picking out foods and things that have a long shelf life that you like. Eat those things and replace them rather than just have it sitting there for months or years on end. So I thought that was really effective in terms of coming to where individual people may be in their situations and talking to them in such a way that it makes relevant sense to them. On your earlier comment, Councilor Belcott, first of all, sorry for your loss. But one of the things that we're also looking to explore down the road is how to engage younger people in this process, because at some point you end up caring for a parent or other relative or family member. And so even though you may not be a part of this aging community, you may be affected and have the responsibility to care for somebody in that community. So we're also looking at that too. But thank you for that comment.
Glenn, do you have a comment?
Yes, I do. Thank you. I appreciate you coming today, and my sincere apologies that it didn't work out the last time we tried to get together. I really enjoy having that really kind of informal session working with the commission. One of the things that I would like to kind of understand a little bit and see if maybe there's some work that we can do to improve it, but a couple of the things in your presentation that you are taking a look at, one specifically is ADUs, and just this last month we approved a whole lot of changes that impact ADUs. And so what I was wondering is how the commission might have been involved in that, because I don't recall having any information come from the commission. And So first of all, I guess I would ask, were you involved in that process at all?
Could you just repeat the phrase that you were using, the acronym?
Yeah, the ADUs, the accessory dwelling units.
Okay, thank you. As far as I know, we didn't have any direct involvement, but we're always open to looking at these kind of considerations to see how they might affect our aging population.
Okay. Yeah, and this might be just kind of a, you know, a point where we can kind of look at our communication strategies. And, when the council's working on certain items, we tend to kind of compartmentalize it and think, oh, this is just land use, so only the planning commission would need to be involved. But when you think about it, all of the different commissions can, in my opinion, should chime in whenever there's a subject that we're addressing that impacts that field of expertise that the commission is representing. So I would encourage you to work with staff liaison to really keep an eye on what our schedule is as a council. And whenever you see something pop up that affects an area in your expertise, to please reach out, form an opinion, and inform us. That's what we depend on you for, is to help us make sure we make good, solid decisions and have all perspectives in mind. So I just really appreciate what you do. And this subject is extremely relative to me right now. I'm going through this process in our family, and it's helpful to have this information, and communication is key. I don't know how you do it, but that is the toughest thing, is getting the word out to all the people so that they know that these resources are available to them when they experience challenging times. So thank you again. I really appreciate all the work that you do.
Thank you, Councilor Young. We appreciate the invitation to be involved in these kind of issues. One thing we found out is that there's a real interesting and often dynamic perspective that our aging community brings to the issues that we thought we were familiar with, but they often point out some different impacts. So thank you for that.
Thank you. Well, thank you, and really for the entire commission for the work on this. It's really excellent work and bringing that forward. And I too regret that our last meeting didn't work out because of technical difficulties. But I would just like to note that, Franklin, you're also a member of the Public Health Advisory Commission. And as I look at this, I can see it very, very much complements the strategic planning that public health is undergoing. So that cross-pollination is I think really magnifies the impact of each of our works. So I'm, I think, picking up on what Councilor Young said. I am interested in how all this good work that is done gets implemented and integrated. And if you can advise us really throughout the years on how we can help put some of this into practice, that would be great. And I know, I believe we have an opportunity with the comprehensive plan update to bounce ideas off of you and how things would work. The other thing I've been thinking about related to seniors is that, and the housing is that, if you're seeing increased vulnerability of the senior population related to housing, are more slipping into homelessness or losing their shelter. Could you comment on that?
The housing situation has been probably one of the biggest overriding factors, because just the lack of proper housing puts a lot of people, especially seniors, into unhealthy, risky situations. So it exacerbates some of the normal issues for older adults. We're looking at housing very closely, and so as we encounter that topic further, we want to come back to you with some specific findings and possibly some recommendations. So thank you for that invitation. We'll keep that in line.
Great, and I also now chair the ECHO, which is the Ending Community Homelessness Organization, so that might be a good forum to discuss some of these issues as you put information together, because that includes members of the council, the county council, and the cities, and those that are providing emergency shelter responses. So that might be a good forum for that.
And sort of, adding and expanding on this, slipping into houselessness. But additionally, we see our colleague Larry Smith delivers meals with Meals on Wheels people, and he is commenting about many of the conditions that he's seeing, particularly post-COVID, that people have lapsed into in terms of isolation, not being able to sort of, or know who those resources are and have contact with very, very few people. So and the idea too of, as people are aging, their homes don't accommodate that particular disability. And so while there are many wonderful groups that are going out and volunteering with handy services to go and do that sort of thing, us thinking ahead about that kind of universal design, which I think was that the handbook was through the Commission on Aging from years ago, also thinking about what would it look like 10, 15 years down the road for someone, and how can we provide these kinds of supports.
Right, that makes me think of code changes might be in order, and we have a DEEB, the engineering advisory group. So I can just see multiple audiences that this information would be helpful for. And then you were talking about emergency preparedness, and I know we had the severe weather this last winter, and then the smoke in the summer, and the ECHO group is looking at the homeless population and how to shelter them in these situations. But I think figuring out that, and I guess I'm wondering what the needs might have been with the senior community during that severe weather situation, if there are any particular needs that were identified.
One of the most critical needs is simply communication. People that have homes and a kind of an infrastructure around, like TVs, radio, so forth, they can get this information in a timely manner, but people on the street may not have that same access. I was surprised that a large number of people on the street have found the need to maintain cell phone service. So we're exploring some things with CRESA on how we communicate with all the different populations within that aging community, given whatever their living situation may be, given a situation like wildfire or smoke or any other emergency event that may take place. So we don't have definitive answers at the moment, but we are looking at how we can address that situation.
Great, that sounds great. Well, keep us posted. Thanks again.
Hey, Cass and Franklin, I'm curious, do you put any of this information in the Messenger? Are you familiar with that newspaper?
Yes. We're in the process of establishing some relationships with some of the news outlets so that we can disseminate information regularly. And one of the things that we're trying to look at is how to direct people to the CCTV, because our meetings where we discuss how to put these kits, together is broadcast. And so for people who can't attend the meetings, that's a great way to be able to get a step-by-step, process of following up on the situation and the information that we receive at these meetings.
Yeah, on the Messenger, I looked at their website, I think it was last month, and it goes out to specifically older folks that aren't necessarily looking at the internet or anything else, and they focus on putting that newspaper in pharmacies, retirement communities, so they really pinpoint that community. And I was just reading it actually last month at my pharmacy. Had a lot of really great information in there, so that's why I was just wondering, since I wouldn't know actually probably unless I was a county counselor about all this awesome information that you've all put together.
we have a lot of community partners that deliver services on an ongoing basis, like Meals on Wheels and so forth. And so before Larry leaves, we're going to look at possibly some ideas on how we can, along with delivering meals or other services, be able to provide some handouts that have some of the update information in it.
Great, thank you. Any other council comments? All right, well, thank you all so much, and this work is just great. I'm so impressed. Like I was talking to you, Cass, I just love what you're doing, and we truly support you and all the work that you're doing. So thank you so much. And with that, this concludes the work session.